Awesome. So if you guys don't know, I'm actually here with a specialist, a hematologist. I'm Justin, a student at Prairie View, best HBCU on the planet. I'm a health student, and I'm also interested in medicine. So I felt it was best that I'd find someone that had experience, and that's why I found Dr. Hills. So Dr. Hills, just go ahead and introduce yourself and tell people who you are and what you do.
Sure, absolutely. Justin, thanks for having me on. I really appreciate you being a chance to have this conversation about patients with sickle cell disease. It's really important for us to increase awareness about that. So my name is Dr. Hills. I'm a physician that takes care of children and young adults with blood disorders like sickle cell disease and cancer. And looking forward to our conversation today.
Absolutely, absolutely. So I have a lot of questions, have a lot of things that I'm gonna cover. But more importantly, I wanted to talk about like what the difference between the trait and the disease is,
Mm.
and what the symptoms look like, and what the disease, how the disease impacts everyday life.
Yeah, that's a fantastic question. Patients with sickle cell disease have a mutation in one of their uh, proteins that lives inside of their red blood cells. And so your red blood cells are important for carrying oxygen throughout the body. And so that protein gets it causes misshaping of the red blood cells. So instead of having that kind of circular disc looking shape to the red blood cell, you end up having sickling, which it kind of looks like a crescent moon. And they are also really sticky, and then they get stuck inside of blood vessels, and you don't get enough oxygen and blood supply to the places that need it, organs in your body, such as your brain, your heart, lungs, kidney, and then even your muscles, and you can have a lot of pain. So patients with sickle cell disease tend to have symptoms of pain, and sometimes some end organ dysfunction, such as their um, kidney disease and heart disease later on in life.
Yeah. So I was kind of reading about the disease and the trait. And I was looking at the numbers. Obviously, it affects Black people disproportionately.
Yes.
It's one in every 13 that has the trait. And then it's also one in 365 who actually get the disease. So there are a lot of people who actually don't necessarily know that they have the trait, and then they marry someone that also has the trait, and then it's also an issue. What are some steps that people can take um, to be aware that they actually have the trait? And
Yeah, yeah, great question. And also, to kind of piggyback to on the previous question, just understanding the difference between trait and having sickle cell disease, as you alluded to, it does take two carriers, someone who has the mutation for the sickle cell disease. But in order to actually have it, you need to have one parent to give a trait, and then the other parent to give another trait for the child to have sickle cell disease. And so, for two parents that are carriers, you can get about every 20, one out of every four, so 25% of the time, you'll have a child who will have sickle cell disease. And so, sickle cell disease gets diagnosed at birth. Since the 1980s, we've been doing universal newborn screens where we take blood from the baby right after they're born, and then we take a and see that they have either a sickle cell trait or a sickle cell disease. Now, in most states, someone with sickle cell trait is recommended that they be seen at least once by a blood doctor. Um, and so that could vary from state to state. But really, if you want to know your status, it would be asking your primary care provider to do the testing so that you'll know if you are a carrier or not.
gotcha. So I know we already talked about the trait itself, but it seems like you mentioned that there were multiple different genes that kind of can be expressed in people's DNA, and there are combinations that can actually give people sickle cell. So
Yeah.
could you talk about the different combinations and like what the different versions of sickle cell are?
Yeah, yeah, absolutely. I'll take a step back before I answer that, and just to make sure that everyone is on the same page. Inside of our cells, we have DNA, and those DNA are basically the instructions for how the cell's supposed to work, how it's supposed to function, and what types of proteins it's supposed to make. And one of those important proteins that lives inside of red blood cells is called hemoglobin. And that's actually the protein that gets mutated in sickle cell disease. And so we have a number of genes that are um, helpful for making these building blocks of the hemoglobin. And when they're mutated, like in patients with sickle cell disease, you can get sickle cell disease, which we tend to call like SS disease. But there are some times where one parent may have the sickle cell trait, but another parent may have a different type of mutation, like a thalassemia, for example,
Yeah.
where they're either not making that much of the other, or they or that one that they're providing is mutated. And so you can get, hemoglobin SS disease or hemoglobin S beta thalassemia plus. And there are other situations where someone has a hemoglobin C, which is just another variant of hemoglobin. And if they're carrying that trait, and another parent has sickle cell trait, and they come together, they can have hemoglobin SC. And so there are a lot of different flavors of sickle cell disease, and many of our warriors our patients with sickle cell disease are warriors. Many of them for sure know their sickle cell disease genotype, because it does impact what their disease course looks like.
Wow. So yeah, in terms of like the complications,
Hmm.
do like what does an everyday life with sickle cell look like? Like, are they able to just live an everyday life? Are they able to be
Yeah.
active? Are they able to have kids?
Absolutely, absolutely. That's such a great question. I always tell, our patients, sickle cell disease is just like one part of your life. It's not your whole life. And, we're always encouraging our patients, they can do anything they want to do. We have some patients that go and become nurses, doctors, lawyers.
Nice.
And so it's great to know that, our patients can do anything. They can exercise. And so we encourage them to get out and exercise and do those things, and just making sure that they maintain hydration. Um, and then, yeah, they can have children. Now, there are risks to having children. So, any of our female patients who become pregnant, it's a high risk pregnancy, just because
Mm,
you are are at increased risk for complications during
wow.
pregnancy. Yeah, absolutely. So any patient who has sickle cell disease who is thinking about getting pregnant should definitely consult with their hematologist, and have a conversation with their primary care doctors as well, just to have a plan in place, and their OBGYN.
Wow.
Yeah.
Absolutely. So it's really a lot to think about. I kind of forgot about this. I have the trade. Um,
Okay.
my parents always told me like, when you were a baby, we got you tested, you and your sister, and you have the trait. But like she'd say it every now and then, but like it wasn't something that like really crossed my mind.
Mm.
So like it is interesting that people can go their whole lives to actually remembering or even knowing, and
Right.
it
Yeah, you're
is.
absolutely right.
And I think like I feel like awareness is definitely something that's not really talked about, especially in the Black community.
Yes.
um, Things like that, anything involving the medical field, there's a lot of distrust, and there's a lot of like just
Yeah,
there's not a lot of awareness.
you're right.
So it is good that I'm aware, I know, and of course like my future, that's something that I'm going to be asking like the women that I see. So um, definitely important in terms of like complications and everything. Now I know you already talked about like the symptoms,
Mhm.
complications. um, what are there symptoms or the complications with the trait? How exactly?
That's a great question. That's a great question. So, the question is, are there any symptoms associated with having sickle cell trait, not
Yeah,
just sickle cell
yeah,
disease?
yeah.
So, most patients with sickle cell trait actually live without any symptoms at all, and have, a normal life. There are some symptoms that can be seen, especially in times where there's high exertion. So you say you're doing a lot of exercising, and you're dehydrated, you're not drinking enough water.
Yeah.
You can have muscle aches and pains. Um, Also, you can see kind of like painless blood in the urine, even.
Oh
And
wow.
yeah, and then so in most severe cases where patients with trait end up having overexertion, they can have something called rhabdomyolysis,
Yeah.
where that muscle
Breakdown of the muscle
breakdown of the
tissues
muscle.
is really too
Exactly.
fast. Yeah.
Exactly. But and so that's why we have a lot of guidelines around both how to, for athletes with regard to getting breaks for hydration breaks, making sure they're able to, take time to rehydrate during practices and during games and things like that for both trait and for patients who have sickle cell disease. And so it's really important that, folks out there know that they have that right to have their break. And it's another reason too to know your status so that you can perform at your best. So yeah, absolutely. Those are probably about the symptoms, but the vast majority of patients with trait don't have symptoms.
Gotcha.
And I think too, it's important to think about like, why does this like disproportionately affect people of color, especially in the US? And, our current thinking is that the sickle cell trait came in our ancestors in
African ancestry.
Africa.
Yeah. Protection
Absolutely.
against malaria.
That's right. Protection against malaria. The malaria parasite does not like to affect red blood cells that have the sickle cell trait. And so more persons who had sickle cell trait were surviving malaria. But then, of course, you end up seeing more patients with sickle cell disease when you have
Mm.
many people who can come together and have a baby who has sickle cell disease.
Yeah.
And it's interesting if you overlay the pattern of the where patients are being affected with malaria the most in sub-Saharan Africa. That's actually also the same place where you're seeing a lot more sickle cell disease and sickle cell
Malaria.
in those areas
Yeah.
where malaria was endemic. That's correct.
Wow. So it's not just because we see a lot of cases in the Hispanic community, like Latin America, also like East. I believe it's East Asia. I was kind of just looking at like the map. They have like the map of where like malaria is more common, and then
That's
you
right.
also see that it's like closely linked to sickle cell disease. So you can
Yeah,
kind of see like that correlation is there, but
it's
it makes
there.
a lot of sense that it is highly present in the African American community because a lot of us have West African roots, and that's why you see a lot of sickle cell trait. But
Yeah, absolutely.
in terms of the lifestyle, I know you already talked about them living a normal life, but like how do they accommodate for everyday life? Like how do they take care
Yeah.
of themselves? What are some things that they can prevent? Um, how exactly are they able to live a normal life while also, taking care of their health?
Yeah, absolutely. It is a challenge. Many of our patients are experiencing pain, and they're experiencing pain on a daily basis. But they have developed coping mechanisms to deal with that pain. They, often are, doing some distraction techniques where, they've, doing some meditation. Sometimes there are warm packs that are used, and a lot of non-medicinal ways to treat their pain at home and at school when they're at school. But then, of course, they do use some medications like, some of the NSAIDs like ibuprofen and things like that, Tylenol, they'll also use at home. And then we will have them to use some stronger medicines if needed. And sometimes if it's unbearable at home, then they'll come to the hospital to get help from us with opioids and other medications like that to help. And I will say here too that I think that what has been a big misnomer in the community is that since they're experiencing this pain and they're taking a lot of the pain medicines and some of the dosing of the pain medicines are pretty high, that when they're coming to the emergency department that they're drug seeking, and that's
Yeah.
absolutely not true. Um,
Yeah.
the vast majority of patients are trying to stay out of the hospital, and they're not wanting to come to the
I mean, I
hospital.
bet. So you're in so much pain, like you. I mean, why would you want to be there? So
Exactly,
makes a lot of
exactly.
sense.
Exactly. And so when they come, because of, I think there is some overlay of
Racial bias.
racial bias, absolutely, on top of a person who's coming in and telling you the medicine that they need. I think that there's a lot more education that needs to be had in the community, in the general public, and for physicians and healthcare providers, that this population does need help with getting their medicines. And if you really look at the data, over the course of time, the main concern for doctors is the opioid epidemic, right? Like
Yeah.
no doctor wants to prescribe opioids if they think that someone's going to overdose or
Of
die from
course.
an overdose.
Yeah.
But if you look at the numbers, the opioid prescribing for patients with sickle cell disease hasn't really increased.
Mm.
And
Yeah.
so, the likelihood that it is that prescribing these medications to our patients with sickle cell disease is contributing to the opioid epidemic is low, right? And another thought is that if a patient is going to come in, one of our warriors comes in and say, "Hey, like I need this morphine, like that's the only thing that works for me," then it shouldn't be a big deal, right? You're actually advocating for yourself because you know
Yeah.
what works for you, because they've done everything at home that we've asked and it's not working.
Yeah.
So
Which is, I mean, that's tough, man. I know you had said something before we had talked. You said that a lot of the medications that people with sickle cell take could easily like kill a person with who actually doesn't have the disease. So like, kind of puts it into perspective. Like, it really is something that they need to like manage their everyday life and their symptoms. I couldn't imagine being in pain like that. I mean, I've seen like the pain intensity and the levels that they're talking about. Like it's feels like constant like pain. Like I wouldn't be able to experience that to any degree, and I feel bad for the people that have to do it. But yeah, it's unfortunate. I think the best thing is obviously showing awareness, making sure people that are aware that the disease is out there. Of course, we want to prevent, the trait from being passed down so that people don't have to suffer, and then we also want to help people who are suffering currently. But
absolutely. Absolutely. And it's important for us to be aware of this, right? One in that if you know someone in your family, or one of your coworkers has sickle cell disease, it's important for you to be aware and check in with them, and also just know that like they're doing the best that they can in those various situations.
yeah,
But we want them to have like a full life. I also wanted to paint the picture correctly, though, that the life expectancy for someone who has sickle cell disease is 20 years lower than the general population.
wow,
Absolutely. And so there's so much work that we're needing to do to try to help improve the lifespan and the quality of life for, our warriors with sickle cell disease. That's my primary research area, trying to figure out what factors are leading to why, our patients are dying early. And though, since we've known about sickle cell disease since the early 1900s, I think first really described in 1910, we only have 4 approved medications
yeah,
for patients with sickle cell disease, when other even more rare diseases has upwards of 30 medications
yeah,
to take care of it, that are in a similar vein with regard to rarity. And so it's important for us to spend our energies and our dollars in having these conversations of how we can make lives better for patients or individuals that are living with sickle cell.
wow. So it kind of seems like there's a lot of research that needs to be done, even though we've kind of come this far in terms of like just treating the illness. But you also said something that really struck my mind. Um, so in 1980, that's when they started testing, children for sickle cell. Now, before that, obviously my parents' generation, they weren't getting tested for it. So
You're
like,
right.
how do adults, how do we get tested? Like, is that something that's offered like in regular blood work? Like, is that something that how do we know? How do
You're
like the older
right.
generation, people
You
who were
are right.
born before there know?
Yes, you have to request that. So when you
Yeah.
see your primary care provider, whether that's a family medicine doctor or internal medicine doctor that you see once a year, during that visit when they're doing your blood work and they're checking to see if you have diabetes or they're checking to see your lipids to make sure you don't have high cholesterol. You can also request that you would like to know if you have sickle cell trait or not, what is
Gotcha.
the status, and then they will send a test, likely a what they call like a hemoglobin electrophoresis or a test of that nature to help them determine if you are a carrier of the trait.
Gotcha. Yeah. I mean, I was
Also,
really.
if
I
you
know.
give
Go ahead.
blood also, if you give blood, they may tell you as well, because, for example, patients with sickle cell, when they're getting blood transfusions, which is one of the ways that we help to manage sickle cell disease when it's not doing well.
Yeah.
Um, we don't want to always like give them blood that has sickle in it. So some folks
Gotcha.
may have trait. That means they make some sickle cells, but
Yeah.
not like a lot. And so in those different situations, sometimes when you go to give blood, they may tell you, oh, you actually, they'll call you and say, hey, you have sickle cell trait.
Yeah. Okay. So that's definitely good to know, especially if you're, in the older generation having kids still. Um, yeah, it's definitely important. But you also want to talk about like the blood cells, like in general, because like uh, obviously they're abnormal cells, but do they also have like the lifespan of the cells? Like, is that
Mhm.
affected too? Like, how
Yeah,
exactly does it affect
yeah,
the blood?
you're right. You're right. So, a unaffected red blood cell that does not have sickle cell disease lives about anywhere from 120 to 180 days in the bloodstream, and then
Wow,
so that's the average lifespan.
it's long.
Which is great, and we need it. It's doing its job. It's carrying oxygen to all the places we need it to, and doing great in that way. For a patient with sickle cell disease, they have a much higher turnover, so anywhere from 10 to 20 days, so up to 2 weeks or so
Wow.
is the full lifespan of it, and that's because you're getting this normal shape and misshape and normal shape
Yeah.
shaping of the cells, and it does a lot of wear and tear on the red
So
blood.
they die.
Exactly, until they eventually just stay sickled. Now, when the oxygen is on the red blood cell, it's normal shape, but when it delivers the oxygen to, the organs, that's when it shapes back into that sickle again, but eventually
Dang.
it just gets stuck in that sickle shape. And so, yeah,
Wow.
those cells die. And so it's important for us to think about that because if a patient gets, just say, a viral infection, that slows their ability to make new red blood cells, they're at increased risk for significant anemia, having really low,
Yeah. Low
red blood.
oxygen.
Absolutely, because their body one is not making enough to keep up with the amount that they're losing. When
Wow.
and so it's very important for us to, when a patient with sickle cell disease gets a fever, it's an emergency, and they have to come to the emergency room to be evaluated and for us to check in and make sure that things are okay.
Wow. That's insane. So a fever is like life threatening. Wow.
Absolutely, and for many reasons, partly too because an organ that most folks don't don't think about or forget about, but as a blood doctor, we love is the spleen,
Yeah.
and the spleen main
Immune
function.
system.
It's right. It's
Yeah.
supposed to help with the immune system. So about the time that a patient with sickle cell disease is 3 years old, they've already started to like have strokes in the spleen,
You're
or
kidding.
they're already, we use the word infarct, but just not getting enough blood
Yeah.
supply and oxygen to the spleen where the spleen starts to die off and you
Wow.
lose function of that spleen. And the spleen protects you from some pretty
Yeah.
nasty
Infections,
bacteria,
like,
right?
yeah.
And so they're at increased risk for those infections. Salmonella being one of those as well.
Yeah.
And so we have improve the lifespan of children with sickle cell disease by giving additional vaccines, the additional vaccines they need to get. And we give them penicillin as well, starting
Mm,
essentially from the first time we see them. And they take it until they have all their vaccines. But in some cases, if they have their spleens removed, they will be on penicillin for life.
wow. Sheesh. Tough maintenance, man. Tough maintenance. But yeah. Last couple questions. Just a few. In terms of like the support groups and resources, um, how do people access that? Where do they find information on this? Like, where do they go?
Yeah, so I would encourage anybody who wants to get involved, and you don't have to have sickle cell disease to get involved. And I would encourage you, if you have any interest at all in being a part of community and helping raise awareness, to Google your local community-based organization for sickle cell disease, and most of them will have resources on for patients on like how to find jobs for our warriors, and they'll have advocates that can help them navigate the healthcare system because that's really important, especially being Black and brown,
Yeah.
trying to navigate the healthcare system as well. On top of that, and nationally, you can look at the Sickle Cell Disease Association of America. They have a lot of resources for warriors and for the general community. And look for events in your local area. Many times they're organized like walks and um, runs and other events to raise awareness of sickle cell disease. It's so important for us to be able to raise that awareness so that we can increase funds for research to help improve life, and also to increase the amount of resources that the community has.
Wow. So that's a lot. That's good though. It's good that those resources are available. I also wanted to ask just one more. Um,
Sure.
what exactly got you into hematology? Like
Mm.
what inspired you to really get involved in hematology?
That's a great question. When I graduated from undergrad, also went to HBCU, so Grambling State University.
Grambling. Ah man, come on now.
Not that far from Prairie View.
Yeah.
But yeah, after I graduated, I went to Harvard for a couple years to do research in cancer biology, and that's really
Wow.
where I started learning more about hematology. And I ended up having a cancer scare myself there,
Wow.
and thought for about a month and a half that I had a rare form of leukemia. And I was learning about all the cells, and I thought, like, wow, God, how crazy is it that I'm here trying to learn about how to cure people
Yeah.
with cancer at the time and could potentially have it. And so I learned a lot about hematology and the blood during that time period, and all was well. I didn't have it. But that really like put in a fire in my heart to be there for individuals that suffer from blood diseases.
Mm,
And when I got to medical school and started taking care of patients with sickle cell disease, it was like an internal calling. It was like, yeah, this is it. This
yeah.
is this is where I need to spend
Yeah.
my energy. This is where I need to spend my life and my passion um toward helping to improve the life of our warriors who have sickle cell disease. And yeah, so that's how it all came into being. I felt like it was more of a calling that was rooted
Yeah.
in personal experience for me. So
Right time, right place,
yeah,
and definitely needed in a field like this, especially with just there being a lack of representation. So that's really important.
yeah.
But yeah, I really appreciate you coming here having a conversation with me. I know I'm a content creator on the side, but I'm also a student. I'm a student first, and that's more important than anything. I was looking for someone who knew something about hematology, knew something about blood, and I'm glad I found you. Glad I found someone from an HBCU. Um,
Yay.
but I'm thankful for this. Yeah, you guys, Dr. Hills, if you need any information, of course, he's also on TikTok. You also practice, so they can find you wherever.
Yep.
And
Absolutely.
yeah, go ahead and donate blood. donate bone marrow, all that stuff. Don't forget
Absolutely.
about that. We can talk about that later. But yeah, thank you so much. Great interview. I appreciate you. You have a
Yeah,
good
no
one.
problem. Thanks, you too. Bye bye.
Bye.